Hi, Dr. DeVries. We have a couple questions to ask you.
Okay.
Why did you want to become a veterinarian?
Well, I've always grown up here in Iowa and always had a lot of animals. So I grew up and I had horses and we had a lot of cats and dogs and I helped to take care of them throughout my life. And so I had to patch them up a lot and take care of them, and I just decided that's what I wanted to do for a living.
Nice. How old were you when you decided this is what you wanted to do?
Probably 7 or 8 years old when I started talking about it, but was already working with animals at an even younger age than that. So very early on, I just kind of had that knack that I thought that that would be what I might do for a living.
What classes did you take in college, and how long did it take you to graduate from college?
Yeah, there's a lot of school involved. So first off, it started even back in high school. I took a lot of the extra science classes that I could, and just got a lot of animal experience. But then I did 4 years of undergraduate college. I majored in biology and chemistry and got a 4-year degree. And then I went to Iowa State University where I went to vet school for an additional 4 years and mainly took a lot of science type classes, a lot of biology and chemistry type classes.
Is it hard to become a vet?
It's a challenge. It is a hard program to get into. Yeah, the undergraduate work is pretty common work, but it's very competitive to get into vet school. So you do have to have really good grades and really good test scores to get into vet school. The year I applied, almost 2,000 people applied, and they took 100 into vet school. So it can be quite competitive to get in.
What types of animals do you work with, and do you have any favorites?
Yeah, right now I just work with dogs and cats here in practice, but I do like them all. It's a close tie between dogs and cats, and I think dogs are probably a slight favorite, but I do really enjoy cats too. Yeah.
What is the hardest part of your job?
There's a lot of emotional components to this job because we love our animals and sometimes bad things happen to them and it's hard to see them in pain and hard to see them hurting. So we do the best that we can to try to help them out, but in some cases there's nothing that we can do to make them feel better, and that's very hard.
What is your favorite part of your job?
Oh, there's nothing better than puppy and kitten visits. You gotta love the snuggles and the cuddles that we get from those guys. It is a whole lot of fun seeing that new energy and the new life and getting them started on the right track.
What does a vet tech do, and how do they help you in your job?
Sure, we have vet techs here every day and they're essential to what I do. So they do a lot of the hands-on work, kind of like a human nurse would do. So I see patients and diagnose things, but they actually administer a lot of the treatments. So they do some of the shots, they do a lot of medicating, they assist me in surgeries, help monitor our patients, they do dental type cleanings for me, everything's under supervision. But they are my anesthetists, they are my dental cleaners and surgical assistants. They take care of most of my equipment, so they really do a lot for me here.
We think you are an animal here. Is there anything else we should know about you and your work?
I think you guys have covered a lot of it. It's just a very exciting job. It's a very hands-on job. I don't sit down very often. I run around and see everybody, spend a lot of time sitting on the floor enjoying the cuddles that we get from them. So it is physical, it can be fast-paced, but it's very enjoyable.
So we've been hearing some noises in the background. Do you think we could get a tour?
Yeah, absolutely. You want to take a walk around?
Yeah.
Okay. Let's take a walk. This area is our main pharmacy and laboratory area, so we process our samples and keep a lot of our supplies for the rooms in this location. Back here is our hospital care and ICU ward and treatment area. So when we draw blood, when we do a lot of our basic procedures, we work in this area. We do our dental cleanings right here on this table. This is Mia. She had surgery this morning, so she's still hooked up to some fluids and recovering. She'll be going home a little bit later today. This is the or Clinic Cat. He lives here with us and keeps us company, so he'll probably help us along with our tour here. This room is our surgical suite where we do a lot of our surgeries. We do have a laser that's over in the corner, so instead of cutting with a scalpel blade, a lot of times we will use the laser to burn through the tissue. At the front of our surgery table is our anesthesia machine. That's what we use to keep our patients asleep for their procedures. And then we have a monitor in the corner that monitors blood pressure, heart rate, EKG, temperatures, just about anything you want to know about how a patient's doing under anesthesia. This is our surgical prep room. We're just cleaning up from a surgery this morning, so this is where we take care of all of our instruments. This is also the room that I get myself ready in prior to surgery and get on all my sterile attire to come into surgery.
Why is it important to have sterile environment?
Sure. When we're doing surgery, we don't want to get infection in any of the wounds or in any of the procedures that we're doing. So we wear special clothing, we use special instruments to help keep them safe. This room's our x-ray room. It's a little dark in here right now. We take pictures from the inside of our patients here. We wear some special equipment to protect ourselves. We have lead gowns that we wear, and that helps to shield us from the radiation that we get. Some thyroid shields here. Come back into our exam room, and this is another room that we use a lot to examine our patients and talk to clients. Take care of them when we're not doing surgery in hospital type.
Is this what they usually sit on?
Our smaller patients sit on the table. Our bigger patients, I just sit on the floor with them for their exams.
Thanks so much for letting us come.
Absolutely. Thank you for coming.
Yep, thanks for being an animal hero to all types of animals.
It's a pleasure. Thank you.
Mm-hmm.